Chetzelco. Shout out to Chetzelco.
Shout out.
Kind of a statement, kind of question. Got a torn ligament in the MCL. He does. That's gotten worse. Repeated injury once or twice a year. It'll slip out, keep me off my feet for a few days. We have anything for him?
Brace up. Go see a doc and start getting some PT. You just want to be careful if you light it up. You don't want to. I don't want to. I'm not your doctor or anything, but like if it gets flared up, you gotta be sure to listen to it and go ask your doc specifically, because there could be some other things going on in there, but see if he wants you to do like a medial unloader brace. There's hundreds, might be exaggerating, but there's a lot of different types of knee braces you can get, patellar unloaders, medial lateral unloaders for certain people.
And is that for like more like a everyday kind of thing, brace?
It can be, depending on whenever it bothers you. If it bothers you for while you're just walking, like, yeah, you could wear it as you're doing things to keep kind of stability and stuff. You don't want to have to be relying on a brace, but sometimes like life happens.
Yeah, exactly. You're gonna go on a trip or something.
But yeah, but that's if it is continually flaring up and it turns into like a chronic thing, you'd want to get like some kind of treatment onto it to be able to at least self-manage it. Because even like a consultation, because a lot of people can't afford. That's one of the things I'm running into. Is one of my least favorite things that I didn't mention actually is dealing with insurances and stuff, and workman's comp, private insurances. And I've gotten patients that they've been like, hey, workman comp gave me 2 visits with you, or 1 visit, a consultation. I'm like, you have X, Y, and Z. Like, I can't fix that in a visit. Yeah, so
I see what you're saying.
But there are some things where you can at least educate them on, and I know I've had a patient come in and just talk to me like, hey, I know I have 6 visits, but I can't afford this.
Yeah.
What can you do for me? And so you can go and at least get a consultation, get education. Here's a home exercise program. Can you build me something? And can you like give me a progression in like a couple weeks? And that's something that your physical therapist should be able to do. And if they're not, they don't care very much, but just get some kind of progression for that.
So Chetzelco did say, the docs keep sending me home with PT homework and a knee brace. So it looks like covering some of that still happening. Probably maybe. What would you say? Anything more to that?
PT homework and a knee brace, kind of, I mean, like I said, that's what I would have at least prescribed at the beginning if you can't get in there to get continual treatment. But if it is really torn in MCL, then you're going to have to get surgical interventions. If conservative management doesn't work, a surgical intervention would be kind of the next course of action. You could look into getting something like a PRP injection, platelet-rich plasma. What they do is they take your own blood, they put it in a centrifuge, and then it actually pulls the blood cells and the platelets back to the back of it. They take the rest of it out, and then they inject those back, so it's like a focused blood cell thing. You could look into that, talk with your doctors about it. I should not be a one-stop shop for this. Talk to your doctors about it, say, hey, I read up on this, or I heard this. That's something they can do. Cortisone injections are a thing. You don't want to get too many of those, though, so I don't really like telling people
to do that. That's actually, my brother gets cortisone shot because he has a spinal fusion.
You don't want to get too many of those, but like, you gotta do what you gotta do sometimes.
Yeah,
so
no, he said the pain is like, I gotta do what you gotta do.
Yeah.
You kind of answered his question, because then he had said, my core question is, should I push for surgery? So we could maybe be in that territory.
Yeah, if it keeps coming up, I would definitely recommend it and look into it, especially if like conservative matters like PT hasn't worked out for him. Then I would, as much as I would like to say, I'm a very success story of I've had like dislocations and torn ligaments and things that have been non-surgical management, and that's kind of why I fell in love with this profession. But it's not for everybody. I've definitely had patients where we've had, we're gonna try conservative. Here's 12 visits, or come in for like 8 visits or six visits or whatever it is, and try this. And I've had to stop there and be like, look, you can keep coming, but I don't think this is going to get better. So we need to kind of take a step back. And I don't want to waste your visits or waste your money or do this. So
yeah, exactly.
There's been a couple. I do know a couple recently in the last couple months that I've had to like take a step back and be like, look, we need to get another consult on this, or I want to get an MRI, or I just don't know. This is outside of my scope of practice.
Yeah.
And I think at that point it's going to be outside of just conservative management.